Hi, honey.
Hi, honey.
We're back.
Yes, you look a little different.
Can you tell how
Yeah.
I changed
You
my
changed
appearance a
your
little
appearance.
bit?
Yeah.
Right?
Yeah.
What did I do?
And you button your shirt.
I did. Now I'm going to go back to the other way because I need to be relaxed when I talk about vitamin D. So,
Part 2.
this is part 2.
A continuation.
A continuation. We may recap. We might throw some extra information in because as I'm thinking about this episode.
Okay.
But
First.
the trivia question.
Okay.
Okay.
And I don't know what it is.
Here it is. In motion picture history. Now, there have been movies where there have been sequels throughout the years. But what movie was the first movie to actually call itself Part 2?
I think I know.
How perfect is that trivia question for Part 2 of this episode?
It's absolutely perfect, and I think I know, but I'm pretty sure I know.
I may have to do something.
I definitely know. Forget it. All right, go on.
All right, so we'll keep
that
people
just gave it away for anybody who knows you.
Riveted. if vitamin D isn't enough, now they have extra reason to sit there. Oh, what are they? Listeners, viewers?
A little bit of both.
Okay.
Go on.
I think viewers would be better. They can see us. They can see how beautiful you are.
Aw, that was very sweet.
Right. Well, look.
I love you.
All right. So here we are. Just a couple of extra points because in that first episode that we did many, many years ago.
Last week.
We were talking about vitamin D, gene coding, proteins. And there are 2 proteins that I want to mention that are especially interesting. So another category of proteins are growth factors.
Okay.
A growth factor is a protein. And as you know, as of late, we're starting to see people with neuropathy.
Yes, indeed we are.
And even though we're deep into spinal disc, I always said I'm not going to brand myself as a neuropathy center, but that doesn't mean we can't take care of people that have neuropathy.
Right.
Well, it turns out that there is a protein called nerve growth factor, and neurons make this.
Right.
Now imagine this. You have neuropathy. You have tingling and numbness in your feet all the time. Basically, neuropathy means that the sensory nerves, if it's in the feet, doesn't have to be there, but the sensory nerves are degrading. They can't repair themselves. They're dysfunctional. Isn't a protein called nerve growth factor something you would want that sensory nerve to make?
I would think so.
I would think so. I would think it's a very important part of the healing process. If you're low in vitamin D, you don't make enough nerve growth factor. So I wanted to make sure we mention that.
Mm-hmm.
And a condition, we talked about brain and we talked about depression.
Yes.
Another brain condition is dementia.
Right.
We know about Alzheimer's. We know they're all under that, all under the umbrella of neurodegenerative disorder. Okay. There's a protein that neurons make that will prevent or I don't know about totally prevent, but if you're in the business of preventing Alzheimer's, there are things that you need to do. And one thing is make sure your neurons are making something called brain-derived neurotrophic factor, BDNF. Every neuron has the ability to make that molecule. And guess what? Once again, if you're vitamin D deficient, your neurons aren't making this. And by the way, I don't know when, but we are going to talk at some point about how giving blood can prevent Alzheimer's.
Yeah.
How's that for a hook?
Yo, that's a big hook.
All right. We take a sip.
And okay, but it wasn't open. I was like,
So I keep using this word deficient. So now we're going to get into
numbers.
I'm going to talk about. I'm going to expand on that story when I started to have an interest in vitamin D. So again, I read the Vasquez article. I'm looking at my patients. I want to do everything that I can to resolve the problem, not a temporary quick crack. You feel good for a couple of days.
Got to come back. Yeah.
The chronic back pain patients would say, not only am I not better, I'm worse. Because at some point you're traumatizing, you're actually causing more inflammation if there are vitamin D factors, D deficient factors going on. So at the end of the day, if you're not addressing the vitamin D deficiency of somebody with chronic low back pain, that's terrible. And this is why I've been trying to educate chiropractors for a very long time. That this is a standard, and if chiropractors are listening to this, I just want you to know something. It's in your scope of practice. This is not something weird that you have to do under the radar and you don't want to get caught. It's in your scope of practice that you can order lab testing.
When we were in school,
it was in the scope in New York.
It was part of our clinic. What we had to do to graduate, our clinical practices, we had to order a certain amount of bloods, do the interpretations, and some of our classmates actually got certified to be the phlebotomist.
Right, and unfortunately, I think the schools now aren't as aggressive in their curriculum.
That's a shame.
But even New York,
I know,
which out of 50 states,
it's
the worst scope ever.
Oh my God.
You were still allowed to order blood work.
Yeah.
And I recognize this.
Yeah.
And I'm talking to chiropractors. Do you have chronic low back pain patients? Yes, I do. Do you know whether or not they're vitamin D deficient? No. Why would I want to know that? Then I explain it. Oh, that's interesting. Do you have any interest? Yeah, it's unbelievable. It never penetrated.
Didn't you partner with LabQuest?
Well, LabCorp.
LabCorp.
Right. So
I think I mixed them up. Quest and LabCorp.
At one point, it really infuriated me that the NYCC they weren't insisting on students clearing. Getting their students to do blood work. We had to do 25.
Yes, we did.
In 1990.
Yep.
And this went away somewhere. I mean, they take one lab diagnosis course. So, of course, when they graduate, why would they want to do this?
Right.
I'm not blaming the student.
No.
If you're not properly educated about why this is so important. So we learn lab diagnosis. We had a thick book. We had to memorize all the lab tests and what they meant.
And the ranges.
How does that apply to a real chiropractor practice? It doesn't. I came up with a whole presentation on lab testing as it relates to the musculoskeletal system and pain.
Right.
LabCorp loved that, and they sponsored me for a while.
Yeah.
And we came close.
Yeah.
We piqued the interest in a lot of New York State chiropractors.
Yeah.
But again, why was I even doing lab testing? Started with vitamin D.
Let's get back to that. Yep.
So I would order vitamin D, and that's really all I ordered for 2 years. Ironically, it wasn't with LabCorp, it was with Quest. So my first account was with Quest, and I would order vitamin D, and that was all. That's all I ordered because that was my comfort zone.
Right.
I didn't really learn this properly in school, but you know me. I'm researching, I'm reading. I said, wait a minute. Maybe there's another marker that might be appropriate for me as a chiropractor. That's when I started to order C-reactive protein, not regular C-reactive protein, high sensitivity CRP. There's a difference,
Yep.
And we'll get into that some other time,
Yep.
because that is probably, it is one of the best markers of overall inflammation. And then over the years, I've added homocysteine, uric acid. So I'm very proud. I think it's quite unique that I have a lab test profile panel specifically for spinal disc degeneration. Who has that? Not many.
Right.
And I think doctors that are treating spinal disc conditions should really include this in their protocol because it's going to make your treatment better. And most importantly, the patient is going to get better. Because if a big component of their problem is the fact that they're chronically inflamed,
chronicity of it,
you're obligated to fix that.
Yeah.
Anyway, so let's go into lab testing for vitamin D.
Okay.
So we did talk about in episode 1 that
another episode 1.
What episode was it?
This
Part
is the
1.
4th anniversary of
Part 1 of
episode
episode 3, which is no,
episode
episode 4. Right. Monday Night Football. That's what's happening.
Yes.
The Giants just scored a touchdown.
Woohoo!
Oh, they're going to be good.
All right. Get back.
Anyway, reel me in. So the vitamin D that you ate or took a supplement or made in your skin, and we're going to go into that in a little bit, goes to the liver, becomes 25-hydroxy vitamin D. That is the storage molecule. That's the one you want to know. That gives us an indication of how much vitamin D you have at your disposal. And then that is further activated in the kidney and every other cell to the 125,
right,
which is activated.
Right.
Sometimes I see doctors ordering that. I really don't know why they want to know that because
that's not the story.
Usually useless information.
Right.
Anyway, so now let's talk about numbers. So the way people are obsessed with their cholesterol number, they should be equally possessed about their vitamin D.
Absolutely.
So if you get a blood test,
like
I send you to wherever I
LabQuest.
LabQuest, we can start our own company.
Sounds like a movie. Go on, sorry.
Or Quest Lab. Okay. Where is this going?
I don't know. No, we're talking about numbers. We're talking about numbers.
So you get your vitamin D tested and you get a number. So here is now another valuable tangent. So it's a general statement about blood testing
what they
in
consider
general.
Normal.
Yeah. You get your numbers back from Quest or LabCorp. Okay.
Mm-hmm. LabQuest.
There's going to be what is called a clinical range.
Right.
So you have this clinical range. And then if you're lower than the clinical range, you have a problem. You're abnormal. If you're over the clinical range, you have a problem.
You're abnormal.
And I got to tell you, a lot of doctors are trained to look at that piece of paper.
That's it.
And they look to the left and they look to the right. They see a red check. Oh, there's a problem. Right? Okay. Let's first talk about where that clinical range came from in the first place.
Yes.
Did you ever think about that? Do you think there's a textbook that like where do these numbers come from? I'm going to use vitamin D as an example because that's the topic of this podcast episode.
That would be a good place to start.
So the clinical range for vitamin D is 30 to 100. Now, the units are nanograms per milliliter. Who cares? So forget units.
Yeah, just
30 is the minimum threshold of normal. 100 is the upper range. All right. You know where those numbers came from? And this is the case for clinical ranges in general. I think I know,
but not sure. Go ahead.
They took a lot of people, and they took their blood, and they measured their blood, and they came up with their numbers. And that clinical range that Quest and LabCorp uses is a statistical average of all those people.
Okay.
Not normal.
Right.
There's a big difference between normal and average.
Right.
A lot of people say, it's normal. No. It's average. Okay? It's not normal for people to be looking at their phone every 10 seconds. It's the average. The average person.
I got a text. Oh, sorry.
There's statistical averages. Right?
Mm-hmm.
So you got a bell curve. Did it ever occur to you that a lot of those people that were tested were sick
Yes.
to begin with?
Of course.
So what are you saying to me?
I'm saying this wasn't the right way to
do
it.
So here's the point. Within the clinical average, there's always an optimum range.
Correct.
And this differentiates a functional medicine doctor, from, your regular. Look, there are doctors that are using clinical ranges. They're not hurting people, but I always use the term survive versus thrive.
Right.
You want to survive, you live in the clinical range. You're okay. You're going to be okay. You're going to survive. You want to thrive? Maybe there's a sweet spot.
Yeah.
Okay?
The optimal range.
It's the same principle with when the government tells you how much of a micronutrient you should be taking in a day, the RDA. You know what the RDA is for vitamin C? Last time I checked, it's 60. You know what that does? It makes sure you don't get scurvy. A lot of these RDAs
Just
are based on
avoid a chronic disease.
To avoid a overt nutritional deficiency.
Yep.
So, and we're going to talk a lot about
RDA
therapeutic doses
Okay.
with vitamin D. Anyway, if you read the research like I do, the optimum range for vitamin D is 65 to 75. And when I see that on a blood test with my patient, I'm happy. Here's how this is what infuriates me even more. I gave you the numbers 30 to 100, right? Mm-hmm. Okay. Let's be very cautious and safe, and let's just split it in the middle. That's 65. Why isn't medicine like saying, okay, let's put you in the middle of this unfortunate clinical range? It's still 65.
Huge range.
But here's the problem. We're more concerned about people being a little over 30 than a little under 100. Because now you start talking about 100, toxicity. I'm going to talk about how real toxicity is.
Do we have enough time for that? We're going off on tangent.
We do.
All right.
Okay.
So
anyway.
Finish on the numbers. I just,
So, in my opinion, anything below 30 is deficient.
Correct.
30 to 40 is insufficient. 40 to 65 is sufficient. That's your survival person.
Right.
I'm all right. I'm here.
Sufficient.
65 to 75, optimal. And depending on the condition, there are some instances where people do even better at 85, 95.
Right.
There's research that says that if you have MS, you need to be hovering in the 90s,
right,
and you're going to get more benefit. So that is just a brief description of ranges and optimal ranges.
There's more to it. There's so much more.
The clinical range, people are worried about toxicity, is 150.
Right.
Who's ever gets there? Okay? So please, if you're in the 80s or 90s, it's not toxic.
Right.
Don't worry about it. And it would be great to spend a lot of time talking about where this toxicity came from in the first place. Believe it or not, there have been events in history where the toxicity was not because of people taking too much on their own. It's because the vitamin supplement company screwed up.
Labeling it.
A very famous study or event was in the UK in the 1950s. So the UK, it's always gray, so there's no sun, so vitamin D there is very low. And, to their credit, we're gonna push vitamin D capsules. And they were trying to make vitamin D capsules of 400 IUs, which used to be the RDA. Some genius at the supplement company, instead of making capsules 400, they were 187,000. That might cause some toxicity.
A little bit.
But, the literature's there. You can't. No. So here's really what you have to know about vitamin D toxicity. It has nothing to do with how high the number is. It has to do with whether or not it's causing something called hypercalcemia. Now, I will say this. Some people, and it's genetic, very rare, but if they take high doses of vitamin D, it makes their calcium go up. I haven't seen this in 20 years, ever, but it's a possibility. So when I put somebody on a high dose of vitamin D, a month later, I'm checking calcium. So hypercalcemia is really what the problem is. And then you say, well, based on that, they have vitamin D toxicity. Well, somebody could have a vitamin D number of 150, and if there's no hypercalcemia, there's no toxicity.
Fine. Right.
Anyway, let's talk about how we get vitamin D.
Okay.
So when you read the list of foods, there are foods, egg yolk.
We need to eat more caviar.
Caviar, of course. My personal favorite is the angler fish. The angler fish, for some reason, is off the charts in vitamin D. Go look up an angler fish. You can't unsee it, and you won't eat it. So let's forget about food.
Okay.
Nature intended for us to get our vitamin D from the sun.
Indeed.
So vitamin D, it's UV, ultraviolet rays.
B.
There are 3 versions of UV. There's UVA, UVB, and UVC. Forget about UVC because it's so small, it burns up in the atmosphere. And then you have UVA and UVB. UVA is longer than UVB. Because of UVA being longer, it penetrates a little deeper. So UVA will go into the dermis, and UVB will go into the epidermis. And that's where we make vitamin D, because there's a molecule which is a derivative of cholesterol.
Yep.
7-dehydrocholesterol. You actually need cholesterol to make vitamin D.
Make vitamin D.
Not going to talk about statins right now, but
that's going to be a good one.
You take statins and you're going to make it more difficult to make your vitamin D from the sun.
Right.
I say sun is great, but the most practical way to get your vitamin D optimized if it's low is to take supplements. And now we're opening up a whole new conversation of therapeutic dose. The first thing I would want people to understand is if you're going to buy vitamin D supplements, make sure it's from a good company.
Yep.
So do you know how many patients of ours take supplements? And when I ask them, is your supplement company GMP certified? They look at me like I have 3 heads. What does that mean? Well, it stands for Good Manufacturing Practices.
Yep.
And the company that we use a lot, Designs for Health, they're GMP certified.
Yes, they are.
There are a lot of companies that are GMP certified. And what a GMP certified company, it means that that company, on their own, their money, they called in an outside agency to check everything out. Assays, equipment, all of that. And at the end of the day, if you're going to buy a supplement and it says 500 milligrams of X, all you want to know, and you deserve to know, and be guaranteed that every capsule has 500 milligrams of X.
Right.
GMP certified company, you can say that.
Right.
Now, is it possible that a non-GMP certified? Of course. But why? Why roll the dice when you're taking supplements? Because the price point is always the same, usually the same. You're not paying that much more money because it's a GMP certified company. Okay. So make sure you're getting your vitamin D from a GMP certified company.
Let's talk about what else needs to be in it.
Correct. And then we can talk about dose.
Okay.
So everybody asks me, how much vitamin D should I be taking? And I say, what's your blood number?
And they don't know.
Don't talk to me about how much you should be taking. Because if I don't know the starting point, are you at 20? Are you at 30? When I did my mother years ago, she was at 12.
Oh, my goodness.
Okay? Remember our patient starts with a Z?
Yes.
Okay?
Oh, gosh, yes.
He was 9.
What a difference.
Okay? Put him on the right vitamin D, he's a new person.
He really is.
Okay? But again, we have to start.
Yeah.
Now I can develop a protocol for you. And I could say, okay, you're going to take 10,000 a day. You're going to take 20,000 a day. You're going to take whatever it takes to get your number to at least 65.
Right.
As you alluded to, it's not just the vitamin D story. So there are two other nutrients that are extremely important in this story. Vitamin K2 and magnesium. If you're going to take vitamin D3, you absolutely must be taking vitamin K2. Here's why. Vitamin D3 is going to bring the calcium into your body. Where do you want your calcium to go?
To the bones.
Bones and teeth.
And teeth.
Okay.
Yes.
Where don't you want it?
The arteries.
The arteries. Well, vitamin K2's job, and we're simplifying here,
very much so, but
is to make sure that the calcium you're taking in goes to the bone, not to the arteries. Yeah, there are studies, one in particular, postmenopausal women who were taking calcium supplements with D3 and no K2. They put themselves at risk for heart disease because it increased coronary artery calcification.
And I actually spoke to you before we walked in here because as I was rehashing and clarifying all of the knowledge that I've gained through our conversation about how they put women, premenopausal and menopausal women, on calcium, and that's not the answer.
No.
The answer is D.
The answer is D with K2.
With K2, of course.
And then finally, vitamin D is my favorite vitamin. Magnesium is my favorite mineral.
D for Denise, M for Martino.
You thought about that yourself?
No, I just thought about it right now.
Magnesium, and we're going to do a whole episode, maybe two, on magnesium. You need magnesium to activate vitamin D.
Right.
And this is something I recently learned. So people are taking the right amount with the K2 and the number's not going up. We find out they're magnesium deficient. You give them the magnesium, the vitamin
through
D
the roof
goes where, well, not through the roof, to 65.
I just
anyway,
that.
the answer to the trivia question.
Woo! Godfather Part 2.
Godfather Part 2. Anyway, you are
Denise.
And I'm Dr. Angelo. And don't let your remaining years be the rest of your life. Make them the best of your life.
Oh, finally.
Things are truly better with us.